So I mentioned earlier that we were going to talk about transmission-based precautions, and these are in addition to standard precautions. So remember, standard precautions are measures that you're going to follow in regards to every patient or resident that you care for. And that is treating all blood and body fluids, non-intact skin, mucous membranes as if they were infected. That's standard precautions. So it talks about when to wash your hands, when to wear gloves or other personal protective equipment. It talks about, you know, how to handle sharps such as needles, things of that nature. That applies here. But then you add a specific guideline for a particular known illness, and that's where the transmission-based precaution comes in. So first of all, let's talk about PPE. PPE is personal protective equipment, and there's a certain order in which you put PPE on. Now, if you'll just bear with me, I have this little trick that I use to remember the order of putting it on, and then I'll explain my rationale of the order to take it off. So if you'll put your hands on your chest, okay, gown. Gown is the first piece of PPE that you put on. Then put your hands on your mouth. Mask. That's the second PPE equipment that you put on. Then you put your hands on your eyes. Goggles. Then you put your hands up in the air. Gloves. And goggles, face shield, it's one or the two that you would use. Goggles or face shield. So, once again, hands on your chest. Gown, up on your mouth. Mask, up on your eyes. Goggles, up in the air. Gloves. Those are the order. That's the order in which you put on PPE. I've learned that from a student years ago. I've used it every time I've taught the class. I see students sitting there at a test, because this is one of the questions that you might see on a test. They'll sit there at a test and they'll go through the motions to remember the order in which they put the PPE on. So that's important to know that. You will also demonstrate the proper way to put PPE on. So you'll want to watch that video so that you are demonstrating the skill correctly. And then you'll have to show me how to take it off. And the order in which you take off PPE, I have like a little rationale that I do to help me remember that. So you think about your gloves are the dirtiest, so you want to get rid of them first. So the gloves come off first. Then the goggles are the most annoying, so they have to come off next because they are driving you crazy. They're fogging up, you can't see. So take those goggles off next, okay? So dirtiest is first, which is your gloves. Goggles come off next because they're the most annoying. Then all you have left is your gown and your mask. Well, you want to leave your mask on to the very last because you don't want to breathe that dirty air. Think about if you're in a room with somebody who has the flu, you want that mask to be the last thing to come off. So the gown will come off next, and then the last thing is the mask, okay? Dirtiest first, so that's the gloves. Most annoying next, which is the goggles. Then the gown, and the mask is last because you don't want to breathe their dirty air. That's my rationale for the order in which to take the PPE off. All right, so let's talk about the different precautions. You'll want to be familiar with these different types of transmission-based precautions. Airborne. Airborne examples would be tuberculosis or chickenpox. These are pathogens that travel suspended through the air. So you just get them by breathing in the same air that a person with airborne precaution breathes. PPE that's required for this would be a special N95 type mask that has a special HEPA filter. A gown, gloves, they would probably need a private room with a negative airflow. These are all important PPE that would be needed. Now, depending on where you work, some facilities will want you to use all PPE for any patient that's on isolation. So you'll just have to know what your policy is for your facility. But it's also important to know why you wear certain things and what's important. So because airborne is suspended in the air, that special ventilation system and the HEPA filter or the N95 mask is really important. Droplet, This is example would be like a flu. Okay, so you think this is suspended or it's sent out through the little droplets that are come out of our mouth when we talk, sing, laugh, or cough, and that's 3 to 6 feet. So think about a yardstick. A yardstick is 3 feet. So take a yardstick and put it between you and somebody else, and that kind of gives you an idea of the range you're talking about here. And these are droplets in the air when you breathe them. If they sneeze and they don't cover their sneeze, or they're talking or something along that line. So you're going to want a mask, right? Because that's going to protect you from breathing that in. And then if they're not in a private room, pulling that privacy curtain will help to block some of those droplets from being shared. The next type of transmission-based precaution is contact, and this can be spread through direct or indirect contact. Examples would be pink eye, C. diff, MRSA, things of that nature. So when a person is on a contact precaution, that can come by actually, like if we'll use pink eye as an example, you stick your finger in their eye, right, and to actually touch the mucous membrane, you can contract pink eye in that way when you touch your own eye, right? Or the person with pink eye can touch their the railing on their bed, right, after they rub their eye. You can touch the railing on the bed and then rub your eye and have pink eye. So that's indirect. So you're going to want to wear a gown to protect your clothing from picking up from indirect methods. And you'll want to wear face mask or goggles for certain procedures. And of course, definitely gloves in a contact isolation type room. All right, so you're going to want to make sure you know how to put on and to take off. So don and doff PPE. Check that out in that video, because you're going to also do a return demonstration on that. Look in your book and read up about double bagging. And this is a procedure or a process that if you are in an isolation room, how you're going to get some of that stuff out. The person standing outside the room has the bag folded over their hands, and they have it open up, and you're putting the dirty linen or trash or waste or whatever in a tied up bag inside there. So look over that procedure. The isolation cart, you need to be aware of that. Does the isolation cart sit inside the room or outside the room? It should sit outside the room, and it has all of your equipment and things that you need that you're going to put on before you go in the room, right? So it's important to understand that process. Know what bloodborne pathogens are. You will see a question about this on your quiz. The example would be hepatitis or HIV. It's microbes that are in the human blood that cause infection, and they're spread through contact with infected blood. So go back over that and be familiar with that.